Hi everyone, today I wanted to talk about some important oral infections like teeth infections. So I'm going to talk about cavities, which are also called dental caries, gum disease like gingivitis and periodontitis, and halitosis, which is also known as bad breath. First, I'm going to briefly talk about the anatomy of the teeth so that we can understand what happens in cavities. So our teeth have multiple layers that protect our teeth. From outside to inside, we have the enamel. This is the hard outer surface of our teeth, and it's probably the hardest substance in our body. It provides an important strong barrier against decay, but it can break down by acids that are produced by bacteria. After the enamel is the dentin. The dentin is a porous layer that's less hard than the enamel, and it has these microscopic tubules that connect to the nerve of our teeth, which is why cavities reaching the dentin can cause sensitivity. And then after the dentin, there's the pulp. This is the innermost part of our teeth, and it has blood vessels and nerves, and this is important for our teeth. If decay reaches the pulp, which is deep, it can cause a lot of pain. And then our gums, our gingiva, are the soft tissue that surrounds our teeth and protects them. So now that we understand the anatomy briefly, I'm going to talk about some oral or teeth infections, starting with cavities. In medicine, cavities are called dental caries, and cavities are actually caused by bacteria. A lot of people think sugar, and I'll explain that. So some bacteria are like Streptococcus mutans and others. So these bacteria live on our mouth, and the thing is that they eat off of sugar. So what they do is, when you have sugar in your mouth, the bacteria will eat it, and when they eat it as a byproduct of their metabolism, they produce lactic acid, and this lactic acid can break down the layers. So the more sugar there is that's left, the bacteria will eat it, they produce acid, the acid will wear out the enamel, and then after the enamel comes the dentin, and then after the dentin comes the pulp. So the process of cavities or dental caries are bacteria metabolizing sugars, which breaks down our enamel and our dentin and can cause holes in your teeth. So that's dental caries. Another oral infection is bad breath or halitosis. It's usually caused by anaerobic bacteria. These are bacteria that live in environments with no sugar or very little sugar, like the back of your tongue or between your teeth. That's why it's really important to floss and to scrape your tongue. So what these bacteria do is they break down leftover food particles and proteins in your mouth, and they produce sulfur, and these sulfur-like compounds produce bad breath. So that's bad breath. It's bacteria, they break down food and proteins, and they produce sulfur. And one way to help with this is to scrape your tongue or brush your tongue really well. So that's halitosis. The final one I wanted to talk about is gum disease, and there's gingivitis and periodontitis. So both of these are types of gum disease, and itis means inflammation. So gingivitis is characterized by inflammation of our gums due to plaque. What is plaque? Plaque is a biofilm of bacteria. What does biofilm mean? It means a community of bacteria. So a community of bacteria is a biofilm. That's what plaque is. These plaque produce toxins, these bacteria, that will irritate your gums and cause inflammation. And if this is untreated, gingivitis can progress to periodontitis, where inflammation spreads to the bones that support our teeth. And this can lead to destruction of the bone and connective tissue and result in tooth loss. Again, it's caused by bacteria, and the bacteria produce toxins. They cause a lot of inflammation and bone damage. And this is where when you see a lot of red, swollen, maybe bleeding gums. So that's why it's very important to floss. Finally, taking all of these things together, and obviously there's a lot of other oral infections, it's very important to take care of your oral health, not because of these infections, but because it could lead to other complications. With any infection, an infection can spread to any part of your body. So an oral infection can start spreading everywhere in your body. Another possible complication is heart disease. So the bacteria from gum disease can enter our blood, and this leads to inflammation and contributes to the formation of a plaque in your arteries, which increases the risk of heart attacks. There's also a higher risk for pregnant women. That's why it's very extra important to take care of your teeth, because too much inflammation can cause premature birth of the baby. So your teeth health is linked to a lot of things, and it's very important to take care of your teeth, to brush, to floss, and to brush your tongue.